We're excited to introduce you to the NobelProcera Zirconia implant bridge, the FDA-cleared all zirconia to multi-unit abutment, which we believe is a game changer for restorative dentistry. As a high aesthetic and high-strength restoration, what sets the NobelProcera Zirconia implant bridge apart is combining simplified digital workflows with an entirely cement-free restoration that utilizes the most innovative Nobel BioCare features. Angulated screw channel with no titanium bases means less fractures and no debombing of the titanium base. We support you with simplified workflows. Whether you are using photogrammetry, intraoral scanning, or conventional impressions, we have the solution for you. You can simply streamline data import to plan with the design software, whether it's DTX, exocad, or 3Shape. We have a dedicated team of experts who are ready to support you every step of the way, ensuring that you have the peace of mind that comes from knowing that everything is being done right. Our implant bridge offers extensive flexibility. We've added some state-of-the-art innovation to this product, and there is nothing similar in the industry. It all starts with our angulated screw OmniGrip tooling that prevents screw from falling intraorally and makes it easy to restore in the posterior area of the mouth, especially in patients with minimal mouth opening. We have the 25% smaller angulated screw channel with new OmniGrip mini screwdriver that provides improved occlusal aesthetics. New combination of angulated multi-unit abutment and angulated screw channel provides restorative freedom up to 55 degrees. We assure you predictable treatment thanks to our FDA-cleared entirely cement-free and tie-base-free implant bridge. In this picture, you are seeing two multi-unit abutments. If you are restoring at multi-unit abutment level, our Zirconia bridge seats directly to the multi-unit interface, all held together with the OmniGrip screw. If you are going to implant level, we use friction-fit metal adapters as part of the bridge. We are not cementing tie bases to this restoration. By focusing on engineering innovation, manufacturing precision down to the micron, and product quality, we are able to offer a solution that reduces complexity and eliminates points of failure found on every other comparable product. This saves you time in the short term by avoiding the need to bond titanium bases, and in the future by eliminating the need for long-term maintenance and repair of those bonds. Science matters. NobelProcera Zirconia implant bridge supports long-term clinical success. Dr. Potsi did a restorative study up to 12-year follow-up of 111 NobelProcera Zirconia implant bridges, and it shows an excellent survival of 98.2%. NobelProcera Zirconia implant bridges provide a reliable long-term treatment option for partial and complete edentalism with no framework fractures. You never need to compromise on quality when choosing the restorations. We're proud to offer our products backed by our unwavering confidence in the superior quality. That's why we've expanded our multi-unit abutment to support all major non-Nobel implant systems. This means that you can enjoy the benefits of NobelProcera restorations, no matter what implant system you use. And now our extended warranty of 10 years gives you even more peace of mind. Your Nobel BioCare team is here to help you treat more patients better. Find out what NobelProcera can do for you.